think it is ER. It's a great show on NBC when it was on.
Rooney used to be on that all the time.
That's right. I forgot. How could I forget that? Fort Worth-based MedStar is in the middle of an experimental medical program.
The company says it has already saved close to $1 million in health care costs. Fox 4's Brandon Todd has the story.
I don't like riding to the ambulance.
Phyllis Chestnut has congestive heart failure, emphysema, and diabetes. Last year, she called 911 46 times and was taken to the hospital in a MedStar ambulance 44 times.
Takes a lot of my time, and they're rather bumpy.
And that made her a perfect candidate for a new program MedStar is experimenting with called Community Health Program. Basically, it brings health care to the patient instead of taking the patient to the care.
They come out here, check my vitals. They check my blood pressure, and they tell me, if there might be something wrong. They'll tell me, what to do and how to do it.
In 2009, when MedStar started this with its Tarrant County patients, they responded to the more basic 911 calls and did so in this van instead of an ambulance. MedStar identified 21 patients who in 1 year called 911 2,000 times. After being in the program, those 21 patients reduced their 911 use by 78%.
She just kept going to the emergency room and calling 911 and calling 911 repeatedly, where now we've been able to get her to manage her care better at home and involve her primary care networks to be able to treat her in a more appropriate setting.
The idea is nothing new, but MedStar is the only mobile healthcare provider in the country doing it on such a large scale. Matt Zavadsky, Public Affairs for MedStar, says the patients don't tie up an ambulance or take up a room in the hospital for things they can manage on their own. This past year, the third for the program, they had 38 patients. Zavadsky says those 38 patients saved Medicaid a total of $820,000 in ambulance and hospital costs. Since MedStar gets paid every time you take an ambulance, they're now asking Medicaid to reimburse them a percentage of the money that is saved.
The cost benefit to the system is huge because every time someone takes an ambulance to the hospital, it costs the payer, or in this case Medicaid, you and I, $500 to $1,500 plus whatever it costs in the emergency department.
They help me out a lot. I mean, a lot.
Brandon Todd, Fox 4 News.
The program has already caught the eye of other hospitals across the country and health officials in Washington, D.C. So MedStar will soon be sending some representatives to the Capitol to explain how it all works.